So someone wanted to know the difference between how the ACom, the anterior communicating artery, and the PCom, which is the posterior communicating artery aneurysm, presents. So you need to know a little bit about this circle. The name of the circle is Willis, the circle of Willis. And so the internal carotid enters your head, becomes the middle cerebral artery and the anterior cerebral artery. And there's a connector, and that's the anterior communicating artery. So the communicating artery communicates between the two anteriors. And in the posterior, we've got the vertebral arteries that become the basilar artery, and then those end as a posterior cerebral artery, the PCA. So you got ACIA, MCA, PCA, and the PCA and the internal carotid artery close the loop on the circle with the posterior communicating artery. And the reason you need to know about these arteries, these two communicating arteries, is because they can come to neuropathy. So the anterior communicating arteries are going to be in the anterior portion, and so the thing we're worried about is pressing on the optic nerve and the chiasm. So those patients present with optic neuropathy and vision loss versus the PCom artery, which is running parallel to cranial nerve 3. And so these people have double vision. So PCom, pupil-involved third nerve palsy, and because the pupil fiber runs on the outside of the cranial nerve 3, when you have aneurysm that is pressing on the third nerve in that location in the subarachnoid space, the first thing it hits is the pupil. So in acute, painful, pupil-involved third nerve palsy, you should be thinking about posterior communicating artery aneurysm versus optic neuropathy. Again, the same story for aneurysm. Painful, progressive, optic neuropathy, vision loss, RAPD, normal fundus, that's going to be the anterior communicating artery aneurysm. And because it's in the middle, it can be either side or both. And as Hemingway would say, this can present gradually from mass effect or suddenly. And we don't want it to present the sudden way because the gradual way is mass effect from the aneurysm. That's the gradual way, pupil-involved third, progressive optic neuropathy. But the sudden way is the aneurysm ruptures and you get a subarachnoid hemorrhage and you die. And so it's super important that you know and recognize ACom and PCom aneurysms the gradual way so they don't end up with the sudden way.